இருடா அது ஏதாவது ஷேர் பண்ணுடா. ஓகேடா பார்த்துக்கலாம்டா. டைம் எடுக்குது. இது எப்படிலாம் ஷேர் பண்ணுறது?
So that was the first round of interview, and as advised, this panel is like the entire, all of you are part of the panel members, and we will ask for opinion from the floor as well, including the PG students. You all can add on because you are not a part of this, like what is being done, but when we come to the further issues, you all can contribute to the topic. And President Dr. Iaphd.
Channel.
So we would like to know how you run your department. Thank you so much for being here. I think discussion is going on almost the same across our country. But knowing what happens in my department is almost the same as what is happening. But I have a few questions, and these questions don't mean that I'm questioning. It's just the thing you speak when the first question is from where the patient comes. Which is a comprehensive patient, where does it come from? Many of them understand that we have to go back. If you want to treat the patient, we need to go back to the start from there, find out who this patient is, who the eligible patient is, care, who is not, if there is something like that. Number one. Number two, what are the human resources required for addressing these services? I think Dr. Shodhan said there's a prosthodontist in his comprehensive care dental clinic. Others had some opinions there. Madam said they went to the prosthodontic department to have a round or sensitization. So we need to understand all these aspects. If you really want to build a standard guideline, an operational guideline, we need to understand first what are the various tenets under which comprehensive dental care will be provided, who is eligible, who is not eligible, what are the scope of services, what is the whole sequence of services also have to be laid out. In terms of, we all talk about promotive, preventive, curative, rehabilitative. So we know the drill. Just that we have to put it in line. If you're talking about development of a guideline, we need to put that in place. And then along with that, a standard assessment protocol also has to be done. When a patient enters a comprehensive dental care clinic, he has to be assessed primarily, and that case needs to be discussed in such a manner that the treatment planning is taken through the whole process. And other than that, patient feedback is again important. There are other aspects like I would say documentation, and other aspects like research could be integrated into it, and obviously feedback from students as well as from faculty. So I think what my opinion about what you wanted to know from me was what is done in my department is just the same as what is done in other departments, more or less. Here and there now, I think since we moved into a new facility, we are able to do better. My PG students are here. They will also agree that what was happening 10 months back is not as what is happening in the last 4 months. So things have changed, but my overall concern is to come up with something what I just spoke about in terms of having all these things laid out, so that if tomorrow all of us have to follow something in terms of comprehensive care, dental care, so all of us know. It is just that whether Shodhan is doing it in SDM Dental College, or whether Dr. Praveen is doing it in Manipal, or whether I am doing it in Delhi, should not make a difference. We should have certain standard operating procedures. We have to have certain checks and balances. We have to do also audits of our own work that we are doing, and maintain documentation in such a manner that it all comes through in such a manner that everybody is able to speak the same language that we are. Same language doesn't mean that we just make it a stereotypical approach. It is obviously patient's need-based approach, but it has to be a more comprehensive, more holistic, and at the same time addressing the patient's needs. So these are a few points that I would like to just put into this whole discussion. And thank you for the opportunity.
Thank you so much. You are just opening the Pandora's box with your questions.
I only did that actually because I felt that is something which I do. The first question was very much about what we do, But the second question should be, how do we go about from here? Now, everybody
Yes.
is doing something, but then let's now come down to make this something more, something more than.
Yes, we are going there. One thing, at least the 50% of the people on stage have their spouse in prosthodontics. So
Yeah, that is one more thing. I was just talking to Naveen sir about where does this patient come from.
yeah.
So when I also put this across to you, when we started, maybe my patient comes from oral medicine because I go and stand there and tell them, please send me 5 patients. I go to conservative dentistry, tell them, please send a few patients to us. So all of us know this, though we will not like to tell it loudly, but this is what we do when it comes to getting patients to our clinics. And this is the truth. So it is accepted. It is bitter, but it is true. But rest, I think others can also add in.
Before we move to the dignitaries, any other faculty would try to say, talk about some unique practices which they are practicing in their department. Any other faculty have some unique practices which they have in their department?
Good morning to everybody. Adding to Dr. Vikrant's thing, I would also say that how many patients, he asked where the patient will come from. And usually we all are known to be camp dentists, going to camp and getting the patients back to us for the treatment. And I don't know whether 10% of the camp patients turn to the departments. So that's a big question mark from where we get. Yes, we do filling, we do extractions, but that's the domain of other specialties also. So we should be able to show to our colleagues or show to our managements in the private institutions how exactly we are better than them. Like when I joined my institution in BHU, there was no department of public health dentistry. As of today, we are dealing with 20 to 25 patients in a day. In spite of I'm having only one PG per year, we don't have any helper in the department, but still yes. And that doesn't mean that we are only in comprehensive dental care. We have filed 2 patents for the fluoride varnish also. We have created our own varnish. We are in touch with the radiotherapy department. So we receive the patients directly from the radiotherapy to the public and dentistry department. So there is no mediation in any of the departments. The patient directly walks into the public and dentistry, passing the oral medicine department or the comprehensive oral care of a cancer patient undergoing the radiotherapy. So like that, we have generated our own credentials in the college. So with the contacts developed, the patient walks into our department directly. We have to send them to oral medicine to go and get the OPD done and come back to our department. So we have to develop a protocol. We have to show to our management and our colleagues that we are also in the boat. We also can help the patient. And as you said, the appointment registers for the specialty clinics, maybe prosthodontics, maybe endodontics, it's quite long. Especially in the government setup, it runs for 6 months. So we should try to convince our colleagues, and it should be always a win-win situation. Like a faculty from the public health dentistry, a faculty from conservative dentistry, prosthodontics, as well as most important patients. Everybody should be taken care of. And we should never ever leave our core of preventive dentistry. So we should do preventive dentistry, and believe me, nowadays among oral cancer, number 1 cancer is oral cancer among all the things. And once the oral cancer patient walks into radiotherapy department, he requires a regular thorough checkup for once in 3 months. Not thorough checkup, thorough treatment. So that is how we should develop the protocol. Thank you.
I have 2 opinions to Vikrant's how do the patient comes. So in our department, I have some experience, but ups and downs are there. I'm not telling we are very strong, is it? So to overcome the crux of this, all the departments will fight, we will do this treatment, we will do this treatment. So in our institute, to overcome this, we have introduced dental health packages. So we normally post an intern at oral medicine. We started counseling, giving them counseling for packages. For example, plan 1 says you have a scaling, you have 2 restorations and extraction. This is the entire package which will be completed on the same day. So irrespective of this chief complaint, so once the patients are enrolling for the packages, they walk into the comprehensive care and super specialty treatment. So this is one way we are trying to convince. We have 3-4 plans. We have a preventive plan, we have an executive plan, we have a basic plan. So that the people will come comprehensively, where the cost is also there. So we will tell, if you do all the treatments on the same day, 10% is less. But from the management point of view, instead of getting in bits and pieces, we are doing the payments on the same day. So this is one way we are trying, but the major crux I tell you where it is. When it goes to super specialty treatments, it depends on the administrators above us. When we call consultants, sometimes they are reluctant, they don't come, walk into the clinic, we have to send the patient, because comprehensive care where there should be strong guidelines is patient will not travel anywhere. Whatever guidelines, whatever treatments from preventive to rehabilitative, it will be on patient will not travel where the consultants can pitch in, but somewhere we need to have the guide document, where our governing council should tell this is how all the administrators also has to follow. Because otherwise, for example, you are all gifted enough to have spouses in Prosco. What am I supposed to do? I don't have. So, if I ask my prosthodontist to come now, they will have 101 questions. And so, I'm just telling you. So, there should be a guide document where the consultants needs to be brought in, because we might not be specialized, or all our team members might not be, because there may be 1 or 2 clinicians in the department also. But all the times there might not be clinicians, so we need to bring in consultants also. There can be a guide document where specialties has to come and treat the patients also. This is the major problem I face. To get rid of the oral medicine issues, we can introduce a lot of packages. Right?
Thank you. Dr. Ramakrishnan.
A very good morning to all of you. I just wanted to introduce 2 more points. See, when we're working in the field of public health dentistry, the background of where we are working is integration of oral health with primary health care. That is the background. So we are doing comprehensive dental treatment in the background of integration of oral health with primary health care. Now when we are talking of comprehensive dental health care, all the activities that we are doing around working, collaboration, etc. is with one point in mind: the patient is the center of all these activities. The patient is a very important person. The patient deserves all the outcomes of what we are doing, collaborating, etc. So there are various aspects in relation to our departmental contribution with all the specialties concerned. Each specialty of dentistry, subspecialty of dentistry, should come out of their silos. In the sense, it should not be working within their own silos. It has to be a response. There has to be a joining of hands, in the sense the specialties of dentistry and preventive component. There is a potential for the preventive component to integrate with each of the subspecialties where we are working. So if you are looking at which are the areas in relation to these specialties, I think we can really add a lot of value and contribute even more meaningfully for comprehensive oral health care. Those 2 points I just wanted to mention. Thank you so much.
Thank you. We'll now move to the observers for their comments.
Thank you. The intent of having this session here today was where to establish the comprehensive clinic. It is a discussion in the I'm talking about the discussions which happen in the Dental Council of India. And, should the comprehensive clinic be a general department in the dental college, or should it be in the Department of Public Health Dentistry? That is the first question which we need to answer. Is it a common department for the college, or is it a department which will be supervised by the Department of Public Health Dentistry? That is one answer we need to give today. The second activity is, who will man the comprehensive clinics? I had a principal, when I say I had, it is the committee in the council when we sit down to do this. We had a discussion where the principal of a dental college came and told me, sir, you are a senior practitioner, senior professor. There are 9 departments in the college. There is a separate head of the department of prosthodontics, endodontics, orthodontics, and they have a separate department to provide that particular care. In what way can you do it in your department? Is it ethically correct or not? When some specialty person is available, can you do that treatment? So I wanted an answer for that in this session today. What is going to be our suggestion to the principal? We have complaints from people saying, sir, originally they started in my department, now they have taken it and given to some other department. So that should not happen. Why they took it from your department? The individuals who run the department must not decide on how it should be run. So the second point was, if you are in a college setting where any of you, for example, if you go to a medical college and if you have a problem in the stomach, and if they have a comprehensive clinic and say the community medicine man will look at your stomach, will you accept first? You always want the chief of gastroenterology to see you, and preferably somebody who has got a PC Roy award so that he will not do any mistake in your stomach. And if that is the case for you, how can a patient come into a tertiary care institution where all the specialized departments are available and you provide tertiary care when you are not qualified? So that question is a very vital, it's an unethical practice. The other side of the question, so these are the things I wanted answered here. Somebody comes and tells me, we should do all the treatment in my department, sir. I'm not saying no to that. We should decide who will give the treatment in that particular comprehensive clinic. The other area, or Madam told, we are going to a camp where there is nobody available. Then a PDS person who is in a primary health center, whatever care he is providing, you are a master's in a specialty, you must be able to provide that care better. So we cannot confuse these two statements. So I just want the discussion to slightly not veer away from this. The first topic is, where should we are not talking about comprehensive oral health care. We are talking about comprehensive clinics in a dental institution. So where should that clinic be? It should be the Department of Public Health Dentistry, sir, is what I want to do as the president and give it to the Dental Council of India. Then he will ask me, who is going to man the department? I have interns posted for 3 months in my department. They say you don't do any work in those 3 months. Why 3 months for public health dentistry? We have a separate program in the EC meeting to give a activity for 3 months. So comprehensive care will be done in care for the patient will be done in my clinic. Comprehensive in the public health domain that we are talking about is different from this comprehensive word. You have incremental care, you have comprehensive care. Those are two different terminologies. Let us not mix that with. When a patient comes into my department, I will provide all the services of the 9 departments in one single place. So that is the comprehensive clinic that we are going to talk about. So will we have specialists from each department posted by rotation to the Department of Public Health Dentistry who will take care of all the patients who are sitting there on a rotationary basis? We need not be assistant professors and need not be associate or seniors. The postgraduate in the specialty who is studying can come and assist the activity here in the department. So that in a tertiary care center, the concerned department person, instead of doing it in his care, will be doing it in our care, under our care. Or will we have only professionals, an orthodontist, an endodontist, periodontist, and 6 of the specialty people, 6 of them manning 6 chairs and doing the treatment in the dental department and public health dentistry. So that if any of you are going to give any further suggestions, it is on these lines. Sir, no sir, in dental college we will not have comprehensive clinic because it is unethical. It cannot be done. They should go to various departments, or we'll have a common clinic like how we are doing their private practice. We call consultants from each department and finish each patient's work. If we are going to a primary health center or a campsite, we must be eligible to do all those activities. Can our PGs alone do them by taking training in the various departments when they are posted for 3 years? Or whether they are going to send some other associate person from the different department to come to the campsite also. So please talk on that for the next 10-15 minutes that we have to go to the next session. So this is the answer that is required for this session. If any PG feels anything here, I want an opinion from them. Sir, I joined the specialty assuming these things, but I don't find that. I would be very happy if all that was taught to me here. Okay, that's sort of a response from that side. Sir, in my department I joined public health dentistry because they told me it is field work and learning. Now my professor is asking me to buy a piezoelectric oscillator and another implant kit because he wants me to do implant in my department. I don't want to do that, sir. That's not my domain. You know, both sides are there for every activity. So if any PG is interested in giving their opinion, maybe one of a couple of them you can ask them to give it now, and then the rest they can all send it by mail. If any other staff member is willing to talk on these same lines, please.
Yes, so before that, I would give a very quick comment. Sir, regarding the establishment of a comprehensive clinic, so what personally an issue may come is if we organize this clinic in the Department of Public Health Dentist, so there, like the orthodontics or an oral surgeon, they may not feel comfortable to come and work under a public health dentist. It's their thing. And second thing is coming to Vikrant's point, who should go to that comprehensive clinic? So one opinion is that should be based on somebody who has some special needs, right? So that comprehensive clinic can be open only for special needs, because that person cannot go to 5 departments, so all the treatment will be provided at that one place. The second is, very interestingly, we visited a private college 2 months back. So what we saw there is that corporate culture. So you have the regular dental college and you have a special clinic where you pay at par with a private dental clinic and you will get all the specialists working there in that clinic. So these are the two probable models. Now before I ask for quick comments from the panelists, any PGs would want or any faculty would want to comment on this thing, like where the comprehensive clinic should be? Can you come in front, please?
Good morning, respected panelists. Like I said, I come from a college, or I come from a relatively newly established department. So like Dr. Ashwin Nahan sir said, that it is, if we come from an institutional setting, it becomes difficult to directly justify to either the management or the administration that why should a public health dentist be in a comprehensive clinic, because all of the treatments which are to be provided are already available within the same situation. So, if we were to establish a clinical comprehensive clinic, like Dr. Puneet said, that we have to have a way to segregate the patient, because it is a patient-centric approach. That whatever comprehensive care we are providing in the clinic, it is for the patient only. We may have unknowingly may have selfish reasons that for example, I personally like to enjoy doing clinical work. So that way, as doctors, we may have personal motivations or professional motivations to do the comprehensive clinical work, but we have to find a way to segregate the patient flow or whoever is coming to the clinic in such a way that they are the persons who benefit the most from this kind of setup. So, along with overall written guidelines that we established, that a public health dentist within a comprehensive clinic should provide this much amount of treatment, I feel like the primary goal of establishing any comprehensive clinic must be that who should be the person who gets the most benefit. That why should this person be allowed or have the privilege of going to this one single position, be treated by only one or a few amount of doctors, and what is the reason that this kind of treatment is necessary to be provided to them. So this personally, this was the question that I would like your opinion or your experience to.
So basically, when the Dental Council of India will form these guidelines, so their point of opinion will not revolve around public health dentists. Their point of opinion will revolve around the patient, right? So for us, for me, I am important, but for you, you are important, right? For the Dental Council of India, the patient is important. So I think patient-centric guidelines will be developed. Anybody else wants to contribute to this topic? Okay.
Very good morning to the respected panelists. I have a question came out from curiosity. Sir, we are public health dentists and we are conducting camps. We can directly visit the camps and issue the OPD cards to the patients and ask these patients to come to our comprehensive health clinics. We don't have to depend on any other department or any management or something like that. We can call our patients, and since it's our patient, they are convinced by us, so that we can easily treat them, sir. Why we have to depend on other departments and other the managements and all? If we can directly conduct camps, in the camps we are providing all the treatment to the patients. We are potent enough to provide the treatment at the camp. So when we are calling the patients at our clinics, in our colleges, why we are becoming impotent at that place?
No, sir, you are totally right. I have seen this practice in many colleges. They conduct the camp and the next day they send the college bus and they get the patients and they are treated in public health dentistry and then the bus drops them. So this practice I think is a well established practice in many colleges. So anybody else wants to?
So we have a UG department. We run a UG department. As doctor said that any patient referred from the camp or the center, we directly refer to our department. We don't provide any transport. Even if they come on their own, they directly come to